Hi everyone. So I am back here with a point, that is Purva Karma. That is in last video we started the Pancha Karma in children, right? In that as it is a long topic, so I divide the videos into short topics. Okay. Today in this video we will see what is the Purva Karma. As I explained in last video, what is Purva Karma? That is the procedure before starting the chief procedures. Pradhana karma is chief procedure. Before starting that, we should follow some purva karmas so that we will prepare our body to eliminate the vitiated doshas, to eliminate or to make the functionless of the accumulated doshas, vitiated doshas. First of all, we should prepare them to expel out of a body, right? So preparing our body or preparing the vitiated doshas to eliminate the out from the body is known as purva karma. So what is this purva karma and what all procedure we will follow in this purva karma, we will see in this video. Okay, what all procedures are included in purva karma? That is shamana, snehana and svedana. Whereas what is shamana? Nothing but shamana aushadis, maybe deepaniya or pachaniya. The internal medicines which we give as the shamana aushadis is known as shamana karma. And next is snehana. In this what we will do? We will make the body abhishyanda by snehana procedure, so that the accumulated doshas will be stimulated by the accumulation part. And what is the svedana? Whereas by abhishyanda, that is by snehana, we will stimulate the vitiated doshas from the accumulation, right? By svedana we will expel out of the body to circulate all over the body, so that in pradhana karma the circulation of the vitiated doshas will be expelled out. So these three are the procedures which we prepare the body or vitiated doshas to accumulate the vitiated doshas to eliminate from the body by shamana aushadis, snehana and svedana, by making them abhishyanda by stimulating, and by expelling out from the accumulation part, and by circulating them with the svedana. Next in pradhana karma, by the main procedures we will expel them out of a body. So we will see by one detailedly what is this snehana and what is this svedana. So first procedure is snehana. After shamana aushadis, what is the main procedure? First procedure to start in purva karma is snehana. Snehana means, as I said, to make the body abhishyanda by maybe externally by applying. This is of two types, that is bahya and abhyantara, right? That is externally by applying oil for the body by massaging, or by internally, that is by internal oil or ghee inhalation. Snehana inhalation by internal doses is known as abhyantara. It is of two types of snehana. This by snehana, what it will do? It will dissolve the dosha situated deep in tissues, and are normally these are vatahara. In vatahara diseases, usually we will advise snehana mainly. And how and what all oils or ghees we will use in this for snehana? Ghrita, majja and vasa obtained from kaga, mruga and jalaja, and taila from tila, chuta, sarshapa, eranda, shigru and karanja from plants are used for snehana. Okay, and the ghee, whereas as we all know, ghee is one type of the snehana, right? Ghee is vata pittahara, but it does not cause kapha sanchaya, whereas taila is kapha vatahara. So usually we will advise taila for kapha vatahara, and vata pittahara ghee we will advise. And in which conditions we should give snehana at what time? That is in vata and pitta prakriti rogas, and in hot climate snehana is done in night times. And if the kapha adhika is there, then we can do it in the daytime. This is the timing or duration of the snehana which we can follow, but nowadays it will not all will not follow these classical references, because as we all know nowadays it become the hospitalized procedure. So all they will do in daytime only usually. But internal snehana we can advise as for the classical references. Okay. And next is method of administration. How it will do? Include bhakshya, vasti, nasya, abhyanjana and tarpana of murdha, karna and akshi. These are the method of administration of snehana. What are those? Bhakshya, vasti, nasya and abhyanga and tarpana. Okay. And next point is dose. How much you should give snehana. That is rasva, madhyama and mahad. That is 3 types of digestion capacities we have, right? That to get digested in 6, 12 and 24 hours. 3 types of digestions durations are 6, 12 and 24 hours, right? Respectively, according to that, by seeing their digestion capacity, we should advise the snehana. And moreover, to remember one point is absolute bed rest is necessary before snehapana after having lagu bhojana. Okay. And another main point is, as we are dealing with children, in Kshirapa children we need not to give snehana, because as the Kshirapa is the age of exclusively breast milk, right? In exclusively breast milk already baby will be in kapha prakopa. So we need not to advise snehana in Kshirapa children. And the duration of digestion is, in Mrudu Koshta the snehapana becomes snigdha in 3 days, while Krura Koshta takes 7 days for snehana lakshanas. These are the durations according to the digestion capacity. As I said, 3 types of digestion, 6, 12, 24. In Mrudu Koshta they will get the sneha lakshanas in 3 days, whereas in Krura Koshta they take 7 days for the sneha lakshanas. And our next point is side effects. What are the side effects of snehapana? If snehapana or abhyanga, if you are not advised correctly, or if the patient didn't follow it correctly, then there will be some side effects. What are those? We'll see. If this snehana, if improperly taken, then produces jvara, pandu, kushta, shodha, murcha, chardi, like this some diseases. In such cases we should go for the Svedana, Vamana and Virechana as per necessity of a person, and give Ruksha diet, Takra and Mutra to drink to cure the improper intake of snehana. Okay. And in sneha ajirna, some persons will be having sneha ajirna. In such cases, if they produce sneha ajirna symptoms, then there will be like Trisha, Shula and Parikartika. In such conditions, you should give hot water repeatedly and induce vomiting after Jharana Kala is over. This is for sneha ajirna cases. You should give hot water repeatedly and you should induce the vomiting in such persons or such patients. Okay. If the sneha pana or snehana is done correctly, then there will be proper digestion and there will be udgara shuddhi, laguta and bala, vak, indriya sampat will be signs and symptoms of proper snehapana or proper snehana, maybe bahya or abhyantara. And our last point is taila used for snehana or maybe for snehapana. What are those? Depending on diseases and dosha, different tailas are used as bala taila, mahanarayani taila, prasarini taila. These are used for abhyanga and vasti. And for oral administration, kumara kalyana grita, meena taila, abhayam grita, like these gritas are used for oral administration. This was the explanation about the snehana procedure, which includes in the Purva karma of Panchakarma. Okay. Our next procedure is Svedana. Kashyapa Samhita in Sutrasthana, he explained Svedana as Balanam Krusha Madhyanam Sveda Avastiko Hitaha शीतव्याधि शरीराणां बालानां च विशेषता. Right from birth of the child, different Svedanas can be used for a children. As the tissue becomes katina, with progress of age, the Svedana has to be increased. Means as the child takes birth, we can use different types of Svedana, but in mild form. Rudu Svedana we should advise. As the tissues becomes katina, we can increase the quality or quantity of the Svedana. And use Snigdha Sveda in Vata Rogas and Ruksha Sveda in Kapha disorders and Sadharana Sveda in Vata Pitta disorders. And in debilitated children and in poor strength, Avastika Sveda, as per the stage of the diseased condition, we can advise the Svedana. And in such conditions, it is not mandatory to follow all the necessary Snehana and Svedana procedures. According to the bala of a children and condition of a disease, we can follow the Svedana. And Svedana is better not to be done in Vrishna, Hridaya and eyes part. And in rest places, Svedana is to be done as per requirements. And this is the main reason. In olden days, our traditional grandmothers, they were following that scrotum is treated with cold water immediately after hot water bath. After hot water bath, the scrotum they were washing with the cold water, because there will be the temperature of the testis is 1 degree Celsius lower than the body. So due to excessive heat, there may be destroys spermatogenesis. So after hot water bath, our grandmothers were washing the scrotum with the cold water. This is the main reason. And this Svedana is not to be given. For some persons it should not be given. It is contraindicated. In which cases? Like Pitta Rogas, Kamala, Madhumeha and Udara Rogas. In these 4 conditions, we should not advise Svedana. And in which conditions we can advise Svedana? That is indications of Svedana. Svedana is indicated in Kaphavata Vyadis, Pratishyaya, Galagraha, Shiroroga, Shiroruja, Shwasa, Kasa, Shula, Ardita, Akshepa and other Vatika disorders of hands and feet, nothing but extremities. We can advise the Svedana. Okay, and some procedure to be followed during Svedana, they explained as: during Svedana, one should keep in mouth the sugar candy so that they will not feel much hot. During Svedana, the eyes should be covered with leaves of lotus, and precardiac area is given cool touch off and on, because as we saw in last point, we should not give some parts of the body, we should not expose to the heat, right? So they are saying the eyes should be closed with lotus leaves, and the precardiac region should be given on and off cold touch during Svedana procedure. By this Svedana, the various channels get opened, facilitates the Snehana dissolved doshas to come into circulation. As I explained, these Purva karmas are to be vitiated doshas in a body to eliminate out of a body by pradhana karma, right? As in Snehana, there will be dissolution of the accumulated doshas. Those dissolved accumulated doshas will be circulated out from the place of accumulation in a body from the Svedana procedure. And Kashyapa explained 8 types of Svedana. We will see one by one explanation what are those 8 types of Svedana. So Kashyapa explained 8 types of Svedana, okay, whereas Haritha explained only 7 types of Svedana. What are the 8 types of Svedana according to Kashyapa? Hasta Sveda, Pradeehasveda, Nadi Sveda, Prastara Sveda, Shankara Sveda, Upanaha Sveda, Avagaha Sveda and Parishika Sveda. but these all 8 types of Svedana we will not use in children. We will use only few, that is according to the condition and according to age of a children. Now we will see detailedly one by one what are these Svedanas, how we will do it, but here I am not going to explain detailedly, just I will give you idea what is Hasta Sveda, what is Pradeehasveda, just I will give idea definition. You should go through the textbook and you should study detailedly from the book or Samhita. Okay, if you have any doubts you can comment me in the comment section box. So what is the Hasta Sveda? It is followed up to 4th month of a birth. You can in Hasta Sveda you will rub your both palms or you will keep the palms to a heat, and your warmed palm will be touched to a baby's abdomen. If the baby is having abdomen pain, where the pain area is there you can touch the warmed or hot heated your palm. Hasta means nothing but your hands. Your palm is heated and indirect heat is given for baby. It is known as Hasta Sveda. And what is Pradeehasveda? Pradeehasveda means application of warm paste of bark and leaves of a shigru, eranda and vasa in Pradeha. Here applying warm paste of a medicated drugs is known as Pradeehasveda. And what is Nadi Sveda? Steam fermentation through a tube connected to a pot in which the decoction are heated and steam generated in Nadi Sveda. Some medicated drugs are heated in a form of decoction in one pot, and some pipe or tube is connected to that pot, and through that the steam is given for your body, is nothing but known as Nadi Sveda. And Prastara Sveda. What is Prastara Sveda? In this hot pulaka or a grain or tusha, payasa or khichdi is spread on a cloth, and the child covered with a fine cotton cloth is made to lie over it and wrapped. The medicated drugs or the khichdi is spread on a cloth, and by wearing the thin cotton cloth the child should be wrapped with this medicated warm drugs. It is known as Prastara Sveda. And next is Shankara Sveda. Shankara Sveda means it is also known as Pinda Sveda. Hot gravels, sand or dust mixed with payasa, krishara or cooked rice and mixed with surabija, dadi and kshira made into balls in a cloth and fermentation given locally is known as Shankara Sveda. All this medicated procedure is made in a form of pinda, that is wrapped in a cloth, and that hot wrapped cloth is fermented for a part of a body, is known as Shankara Sveda. Next is Upanaha Sveda. What is Upanaha Sveda? Application of warm poultice that is drugs mixed on a cloth and touch on a site of a pain is known as Upanaha Sveda. Whereas in Shankara Sveda or Pinda Sveda we will make the paste in wrapped in a cloth by we can hold in a hand like pot, right? But in Upanaha Sveda we will spread the warm paste on a cloth and we will apply on a site of a body. Next is Avagaha Sveda. Avagaha Sveda means this Avagaha Sveda details is missing in Kashyapa Samhita, but we collected in from some other textbook, as it is a tube bath in which warm decoction or urine or kanji are used. A child is made to lie in it dipped with head outside, and liquid may be made warm repeatedly. In a pot the warm decoction which drug you will use is kept, and the baby is made to dip in that decoction by making the head upside of a decoction. This decoction or a medicated procedure medicines you can heat repeatedly if there is necessary. Last one is Parisheka Sveda. Parisheka Sveda means in it slow pouring of stream of water or oil or liquids or maybe takra or milk on a particular part of a body is made. We can compare with this with the Shirodhara, right? As in Shirodhara we will make the medicated oil, warm oil to pour on a Shira region. Like that, in some other part which we have pain, you can follow this procedure. It is known as Parisheka Sveda. So this was about the Svedana procedure. As all the procedures will be having some side effects or alpa results or samyak results, right? Like that, the Svedana also have 3 types of results, that is Mandasvinnata, Atisvinnata and Samyak Svinnata. Mandasvinnata means if the Svedana is given in alpa form, then there will be produces Guruta, Stabdata, Trishna, Glani and vertigo. In such cases you should repeat this Svedana as per necessity. And next condition is Atisvinnata. If the Svedana is given in more form, means more than the tolerating capacity, then produces Pitta Prakopa and Daha. There is thirst, restlessness, Brahma and Morcha, and there will be weakness in body and voice. In such cases treat the patient like the line of Visarpa, and Raga, Vrana and Morcha are serious to treat. If these 3 conditions are there after Svedana, then they need the severe precautionary treatment. And last one is Samyak Svinnata, means the correct procedure. If you followed the Svedana correctly, then the body and complaints becomes Mrudu, there is Prasannata and good appetite, thirst becomes normal, and all reflexes like Mala, Motra, everything will be normal. Overall the body will become Lagu in nature, and the person will be very calm. So this was about the Svedana procedure and types of Svedana with their explanation. Okay, this was about the procedures of Purva Karma, that is Shamana Aushadis, Snehana and Svedana. What is Snehana, what is Svedana and what are Shamana Aushadis? We came to know in this video. This was about the Purva Karma which is followed in the Panchakarma procedures. Okay, and if you have any doubts, please comment me in a comment section box, so that I'll get you clear that whether I am dealing a topic in correct way or not. Okay, thank you.